Hi, my name is Dr. Virginia von Schaefer. A hot topic among many patients and many people, I guess, but definitely the people that I get to meet who have cancer or chronic illness, is the subject of what do I do for nutrition? Is there something I can do that's going to help me more, or are there things that I should avoid? Is that deterring my progress? And it becomes, as you can see if you look on the internet, a very complex project because there are so many different opinions about what's the best thing to do. So as a patient, it becomes a really daunting task. And of course, in my practice, because so many of the patients are stage 3 and stage 4 advanced cancer patients, it becomes a real issue. Many people come to me having gone on a complete plant-based diet, and they lost anywhere from 20 to 50 pounds. Well, weight loss can be great. However, if you have stage 4 cancer, it's not a good idea to be too thin. It's not a good idea to have zero or marginal metabolic reserve. So the issue becomes, what to do, how much should you do, what's too much, what's not enough. So what I try and explain to patients is that we want to have appropriate gut microbiome, and we want to have food intake and energy production to the point where you're going to be able to accommodate not only the cell renewal of the cells that you want to keep, but the ones that you have to replace, because every 5 to 120 days, all your cells are dying and being replaced with the exception of a few brain and spinal cord cells. So there's a huge metabolic demand ongoing. And if you want to support that metabolic demand and at the same time are undergoing chemotherapy, chemotherapy involves killing rapidly dividing cells. Where in the GI tract, some cells are only living a few hours. Goblet cells in the stomach are 5-6 hours. That's it. So I take the position that if you eat a clean diet and as healthy as possible in terms of organic or pesticide, chemical-free, additive-free, that type of thing, that's going to support your metabolism in a very productive way. In other words, we have to fuel our bodies in order for them to reproduce and make new cells. At the same time, it's pretty common knowledge that most cancer cells, because they metabolize in an anaerobic manner, their preferred energy substrate is glucose. So, hence the mandate that everyone should avoid all sugar, not eat any carbs, and try and limit your intake even of animal fats, because of all the animal fats don't have anything to do with the glucose issue, but it is a contaminating factor, many people feel. But so the truth of the matter is, even if you eat a lot of protein, that could be turned into glucose. So a balanced diet, eating in moderation, and eating clean, but eating and satisfying yourself is very, very important. I always tell patients I have to have a patient to treat. So if all you're doing is taking supplements and not eating any food or eating very little food, you're going to deplete your body's stores and make yourself metabolically less resilient. And when it comes to difficult treatments, whether it may involve radiation of some sort or another, or chemotherapy, even natural treatments, you have to be very, very careful. So I think, yes, avoiding sugar is a big deal. And other than that, I try to let patients just eat to satisfy themselves as best as possible. Now, what about fasting? Everybody's always talking about fasting. at least intermittent fasting is a very, very good habit, even for a healthy person, because it's simple to do. If you eat dinner at 5 o'clock and you don't eat breakfast till 9, bingo, intermittent fasting. You've had 12, 13, 14, 15 hours 16 hours of fasting. So this allows your body to select out for cells that are sick or need to go, and it kind of signals time to die. There's such a thing as apoptotic proteins that are released. At the same time, that word that they use is autophagy. So cells literally are broken up and taken out of the garbage, okay? So that's a good thing. However, fasting for days, I've had patients do a water fast for 40 days. Did the tumor get smaller? No. Patient lost weight, patient lost muscle mass, and of course when you lose muscle mass, you lose metabolic reserve, and of course the tumor got bigger and the patient got smaller. It's just not useful. So the best I can recommend is eating a clean, good diet, sort of like a Mediterranean style, having a very good, diverse intake of different fruits and vegetables so that you enhance the diversity of your gut microbiome, and at the same time, conduct some intermittent fasting. Avoid that sugar. Do the best you can, but survive. Thank you.